Dr. Pat Oakley, and so one of the things that I think we need to recognise here is that we're all learning how to provide outreach to Indigenous Australians, because our country is way behind in recognition of our first Australians. And so I'm now at Katherine Hospital. I've been there for 6 years now, and when I arrived in Katherine, it was a bit overwhelming to try and understand the context of healthcare, and I'm very grateful for Pat's mentorship that actually has very much contributed to the way I've been set up my outreach model, and also all the training that I got at John Hunter Hospital that was really focused on making me well prepared for the task at hand. And so Catherine's obviously a deeply rich region of Australia, and as we've seen today, there's clearly a lot of different environments, both urban and very remote. There's different environmental constraints to outreach, and so there needs to be different solutions. But Noel, when you're telling me about your service, and I've indeed visited it, I'm pretty envious because ours is nothing the size of it. So you have a lot of people in a very small space. I have very few people in a space the size of Victoria and 2 Tasmanias. So there's about 12,000 people living in very remote communities, and they deeply identify as each tribe here: Warlpiri, Nariman, Naliwuru, Mara. There's 27 languages still spoken in Katherine today. And so when I first arrived in Katherine, and I think when I was invited to be a part of this medical specialist access framework, it was at the very tail end of its development, and I opened it, and I'd really recommend that you look, if you're interested in it, at the resources section. It was really exciting to see such a comprehensive document that really set out the constraints and the expectations that you have. So when I arrived, there was 5 communities that had specialist outreach to some extent, and it was not a very strategic model. It was the way that it's developed probably across Australia is clinicians have realised that there's a need, and this is just the adult medical, including some specialty services. And I think it's well and truly time that we as a community of physicians start to be strategic about how we deliver remote healthcare, because it is really important, and this document is a fantastic start to a comprehensive plan for the whole of Australia. So in 2013, I realised, I asked the lady from Borroloola to come back so I could see that her ankle was negative, and I opened the computer system and looked up the results and said, "That's fine, it's not a vasculitis." And she looked at me with a bit of dismay, and she said, "I drove 800 k's for that." And so I recognised in that moment that you really need to be very cautious of not wasting people's time. They travel vast distances to see specialists in this part of Australia, and you want to add a lot of value when you see them. So another story that I had